Welcome to the Point of Medicine podcast, brought to you by LearnNeuralTherapy.com. Doctors Ann Hill and Ilana Gurevich team up to take a deep dive into the art and science of healing. This podcast explores cutting-edge approaches to the autonomic nervous system and its role in organizing fascia for optimal health. Each episode features conversations with leading clinicians who are pushing the boundaries of medicine, uncovering new insights, and transforming patient care. Join us as we bridge tradition and innovation to expand what's possible in modern healing. This podcast is for informational and educational purposes only and not intended as medical advice. Please consult your healthcare provider before making any changes to your medical plan.
Hi, everybody. Welcome to another installment of the Point of Medicine podcast. Today, Dr. Hill and I thought we'd do something a little bit different. We thought really one of the biggest foundations of neural therapy is utilizing or understanding the interference field. And this is a concept that I feel like when we're teaching a lot of our students, they have to wrap their mind around it. And what we realize is as we're having these conversations with these clinicians that are practicing neural therapy on a daily basis, we're throwing out the interference field, but we want to make sure that people really understand what it means and really understand how it can affect long-term health outcomes. So Dr. Hill's going to start out by just giving us an explanation of an interference field, and then we're just going to talk about how it presents in our practice.
Okay, great. Well, first, what I want to start with is Matthias Dosch, who is one of the biggest medical doctors who kind of published a book on neural therapy, I think back in the 50s. And his explanation, so let's just kind of break down the explanation. So his explanation of an interference field is any stress which exceeds the limits of tolerance and sets off a shock reaction in the autonomic nervous system. So how we see that in some ways, or how I've tried to wrap my brain around what it is or how it makes sense to me, is where we have the nervous system. And when the nervous system just gets completely overwhelmed, it tries to protect itself. And so it actually stops sending a lot of information. And we see this actually, one of my favorite examples in class to give is when we're dealing with different infections. You know, if we have an infection or a vaccine, which is basically we're trying to introduce the immune system to an infection, sometimes the nervous system gets so overwhelmed that it just basically tries to keep that area at bay. So one of my favorite examples is tuberculosis. And when we think about what tuberculosis looks like and how our body deals with tuberculosis, we can actually see on the cellular level that the immune system wraps like a whole, almost like a castle wall around the tuberculinum bacteria, because it doesn't want it to spread. It doesn't, the body needs to keep going. So it needs to keep like this infection in one place so that it can kind of keep an eye on it. So that's one way that I look at interference fields. Another way is looking at emotional interference fields. And that is like when we have gone through a whole bunch of trauma, the body will also store things and hold things in the cellular tissue. Again, the nervous system has a lot to do with this. It's not just a mind that's separate from the body. The whole body can store emotional traumas or physical traumas that have happened to it. And so I think similarly, it probably has sort of a lockdown mechanism that happens to keep that traumatic experience from continuing to sort of wave through the body or go up to the brain and make the person unable to function. Because ideally, we are the roaches of the world, right? We are supposed to be able to continue going on even after we've had injury after injury or trauma after trauma in our lifetimes. So those are my kind of initial thoughts.
The way I always talk about it with patients and with clinicians is, I look at it in the context of the nervous system, right? There's the brain and the spinal cord. That's the central nervous system. Then that nervous system, once it leaves the spine, it's now the peripheral nervous system. Those nerves travel from the spine through the organs to the skin, back to the organs and back to the central nervous system. It's a loop. And so if you have something that's interfering that loop, all of a sudden the body is blind. And that something could be a scar, it could be a trauma, it could be a physical, emotional trauma or a spiritual trauma, it could be a chronic infection. And so if that loop is blind. Now, all of a sudden, the nervous system is not sending information the way it should. And that's when you get a buildup of pressure or completely no pressure that causes you to be uncomfortable. That interference field is going to interfere with the function of the nervous system. And so the important thing to know is our goal is literally how do we reconnect? How do we remake that connection? And the easiest way that patients usually understand it is it's like a computer, like sometimes you're getting the wheel of death on your computer and you just have to shut it down and restart it, which is exactly what we do with Procaine in particular. And then that affects, that it lets it reset and affects change in the body.
Another way that I think another way to think about it too is through the polyvagal theory. So what Ilana's talking about, of course, is, kind of the more physical properties of it. But with the polyvagal theory, I think he laid out that there's a ventral and a dorsal part of the vagus nerve. And we have the parasympathetic nervous system, we have the sympathetic nervous system, and we also go into this, basically freeze state. And that's actually what kind of the definition of PTSD, are patients that are stuck not in the parasympathetic, but they're stuck in between the sympathetic and that freeze state, like after having a whole bunch of trauma and things happen to them. And that can happen on a global level. And that's when we think, oh, this person, they're a veteran, need to get, they need to get Procaine, they need to, they need to get through this, this state. But it can also happen on these very small cellular levels throughout the body that we don't even realize are happening. Again, because the body is so good at existing and surviving that it's just going to keep it in one place if it can, so that the whole body does not have to continue to experience that. And I think probably some level of PTSD or CPTSD in some way is a conglomeration of multiple traumas that happen over and over and over again. And I'm not just separating mind and body. I'm talking about physical traumas as well as mental emotional traumas. So,
Can we tell maybe some patient stories about how we experience that interference field?
yeah, that's the funnest part. Okay. Let me start because I've thought about this for a while, because I remember when I first started doing neural therapy in my practice, I had a pretty interesting case. This was a patient I had been seeing for a long time. And we would oftentimes do, I do osteopathic medicine. So we did a lot of cranial sacral. And I had been treating him he had gone on like a bike tour through Europe. And so he had a lot of pain in the back of his Achilles tendon, and he had never had that before. And I was like, oh, it must have been some kind of, tendinitis or something that happened. But we treated him. He was also getting acupuncture and massage and a whole bunch of other things. So we treated him for several months, and the pain always kept coming back. And so literally, like after I had my first, class in neural therapy, I came back and we were treating him again. And it was summertime. So he had, in summer, people just take their shoes off and, you can see their feet. And I was looking at his foot, and I didn't know this about his health history because, excuse me, you don't oftentimes tell your doctor every single surgery you've had, but he had had a neuroma on top of that foot where he was having that pain. So I saw this little tiny scar where he had had the neuroma removed by a surgeon in between I think it was the first and second toe, or second and third toe. And it was just a little, like kind of a long scar on top of the foot. And I said, look, I don't know if you're into this or not, but I just learned this thing and maybe we could try doing it. And he was up for it. So, because everything else he had done, was not really getting at the actual problem and the pain that he was still experiencing after this long bike trip. So I just did the scar, and he reported back afterwards that all of his pain was completely gone. So this was on the same foot he was having trouble with. Nothing else was really working. But opening up or having the nerves in that scar tissue work better, I think helped really connect the dots with his immune system and his whole nervous system, so that his body could finally process and get through whatever it needed to get through to feel better. So that's one of my like that was actually I think my very first scar, like not on another provider, but on a patient that I had done with neural therapy. So I always think about that one a lot.
I have a different one that where the entire ganglion was the interference field, which is, because it could absolutely be a location, a scar, a laceration, something that had a lot of emotional trauma. And the other thing it could be is, so I had a patient and she got pregnant, and she had a very, very close relationship with her mom. And when she was about 3 or 4 weeks pregnant, her mom got diagnosed with a terminal cancer, and they were in the hospital. It was already at diagnosis of stage 4. It was very inoperable and intreatable, and they really didn't do very much. And she was in the hospital. It was when she got admitted where they found the cancer, and she was pregnant, and she was watching her mother pass away before her, and her mother ended up dying before the baby was ever born. And after her mom's death and the baby was born, she began having all of this anxiety, which was really not in character for her at all. She would wake up in the middle of the night. She was convinced the baby was going to die. She was convinced her husband was going to die. It was all of a sudden she was anxious all of the time, which, makes sense from a psycho emotional place. And so I was like, I want to inject, and really what I wanna do is I wanna do, oh my god, what is that? It's the pelvic injection. What is that ganglion that I'm injecting in?
Oh,
The hypo oh my god,
not hypogastric.
no.
Yeah. No, it's the Frankenhauser.
The Frankenhauser
That's
modified.
mostly what we refer to it as. So, yeah.
Um And so I injected her, and all of a sudden, as soon as I did the injection, she started wailing and crying, and all of this grief started moving out of her. She could not stop, nor did I want her to stop. Like, that's a very important detoxification that's happening, is her wailing and crying. And she started wailing and crying and, like, really emitting all of this grief from her mother's death. And after that, the anxiety was probably like 40 or 50% better within just that one injection.
Yeah.
And then we ended up doing a series of them, and she was able to really bring down, she was no longer waking up in the middle of the night. For her, that root chakra, that pelvic floor that was tied in with the pregnancy and tied in with her mom's death was the interference field. And when we reestablished it, she was able to actually embody her body again.
I mean, to me, I just think that's so incredible that we hang on to, again, without even really knowing or understanding all of this emotional stuff that we've been through, that we think, oh, yeah, I'm over that, whatever. And then it comes up again. I frequently have had people that I start working with them and they will start remembering things that they hadn't remembered in a really long time. And they'll be like, oh, I wonder if this might be a problem. And then they'll be like, there's this scar here and this scar here. Yeah, I just had a recent patient who had a burn scar um, on her right hand. And so we did that. And then we also did, she had also had like some cancer on her nose. And so she also had like scar tissue taken from in front of her ear to put on her nose because they had to take off a whole bunch of the tissue. And there was one other thing that had happened on her right side too. But we just ended up doing all those scars. And interestingly, she was a Lyme patient, and she expressed a whole bunch of anger afterwards. And to me, I've seen that a lot with Lyme patients that will start treating them and they have a lot of anger. And this is kind of a whole nother thought process. But I do think that a lot of times what our thoughts are or our feelings aren't even ours, but they're actually from the infections themselves. So I do think Lyme is kind of an angry infection. Like I feel like I've connected the dots with enough Lyme patients that makes a lot of sense. And then we also had that really cool class where everybody had strep throat. Do you remember that?
Yeah.
Do you want to talk about that one?
Yeah, it was an interesting thing where when we teach, there are like the classes all develop an energetic being, like there's the energetic being of each individual. When you come together and you do these intensive classes, and when we teach, that it's a lot of hands-on, you are getting a lot of injections. And so when that happens, what happens is there's like an energy that flows through. It's like the participants in the class are like a brand new being, and you feel really tied in. And one of the things that Anna and I have noticed is like one year, I'm going to talk about the knee and maybe you talk about the strep. One year we called it the knee class, And it's like what we would do these pretty non-emotional or non-invasive injections, just dealing with like different scars or different patterns within the knee. And all of a sudden we get these huge emotional responses from like getting their knees injected, where people would get like really all of this emotion would flow through them. It's not clear why, but that was the knee class. And sometimes something that we would consider benign, like a knee injection, causes all of this wave of processing to come up.
Yeah, that was very interesting. Yeah, because I don't think I'd had a lot of like knees in my
Yeah.
practice that were like, whoa, you know?
No. They're usually a little bit stingy, a little bit uncomfortable, but that's not the thing that I'm expecting to have to hold a
Right.
lot of space for.
Yeah. Well, okay, so the tonsil class, that was the class where we ended up having a whole bunch of people in that class who had a history of like recurrent strep tonsil infections in their youth. And for anybody who's had strep, they probably know that there's a very specific way that you feel in your body when you have strep. And that's what I think is like, I do think that these bugs have a way that they affect our brain chemistry and that they can make us feel. In fact, we know that from studies that they've done on the vagus nerve. Like the vagus nerve sends information. It doesn't just get information from the body, but it can send information down to the rest of the body. And it can it can send information from the infections that we have. So in the tonsil class, so one of the injections that we do are tonsils. They're very important injection. The tonsils are basically where our mouth opens up and we take in the world. We take in our breath. We take in our food. We take in our moisture and liquid. We take in words from other people, so all of these different things. So in the tonsil class, we did the tonsil injections. And everybody that had strep, which was probably about 3/4 of the class, I remember they were all sitting on chairs after the tonsil injections. And they all just had this like look on their faces like, "Oh my God." Like, because they all said the same thing. Like, I feel like how it feels like when I'm about to get strep throat. Like there's this very specific feeling. And that to me it was kind of, I've definitely heard that, since and before in my practice, but kind of having a whole group of people that we did that injection to that all sort of were saying the same thing really helped solidify for me, like, oh yeah, sometimes these infections that we have, or not even, and I'm not even talking about acute infections, also, we have chronic infection in our tonsils, especially when we've had a lot of strep infections, that is going to hold on to a certain emotion or feeling that we're going to process.
So there's like the scar, we're in the trauma phase of
Hmm.
an interference field. That's one line. The other thing that clinicians are looking for when they're expecting an interference field is chronicity. Like the infection piece is a big piece of what causes interference field. Chronic cystitis, chronic gastritis, chronic esophagitis, like anything that's coming up again and again and again that the patient can't get rid of. And what happens with patients when they have interference fields is they have this like hyper awareness that there is something wrong with this organ, but in many ways they feel like providers aren't listening, or maybe providers aren't hearing, or maybe providers are gaslighting them and telling them this is normal, but they will have this intense emotional pull to let you know this is dysfunctional. And that's the other place to really you want to listen to when you're thinking about injecting an interference field. And a scar, so Anne is completely right. I will ask all my patients about scars. They will forget a bunch of them. I'll have them on the table and I'll be like, "What's that? What's that? What's that?" And they're like, "Oh," and they start processing or remembering the scars. With infection-based interference fields, this is usually the thing that's making them crazy. Like they know there is something wrong, and that's why they're dealing with this problem again and again and again. It's like the exact opposite, where they'll be like, they need you to hear them. And then, injecting is such an easy and quick technique to try to reestablish nerve innervation to whatever organ is dysfunctional so that we can reset the nervous system and start the process of working it. The Go on.
Go ahead.
The other thing that I want to talk about that is sometimes when you inject that organ, what's going to happen is a repetition of symptoms that match exactly how it was when that organ had an acute infection, but there's no acute infection that's findable. And this it took me so long to understand with my patients and like to properly school my patients about. So, like a great example is I had a patient come in with a chronic interstitial cystitis, right? So she had urinary urgency, urinary frequency, urinary pain. She could sit on the toilet for hours feeling like she needs to go urgently and like little dribbles would come out maybe. Right. And I had one particular patient who had a very crazy story where was pregnant. She was very young when she had her first baby, but she knew she didn't want to have any other babies. And so she went in, she delivered. It was a complicated delivery. And she said, I want a hysterectomy. I'm done. And the doctor said, no, you're too young to make that decision. And so instead of having the hysterectomy, the surgeons showed up. There was a cesarean. The cesarean had all kinds of issues. The surgeons sewed up the uterus and then sewed up the abdomen, but very, very tightly. And the patient was dealing with chronic pain ever since then. And what happened was one of the things that complicated that delivery was the fact that she was having chronic urinary stuff. And so she came in, she had seen so much care from so many people and done so many different things. And so she came in to see me to get an injection. And within 24 hours of me injecting that scar, and it was a big scar, she started feeling all of the urinary stuff again. And she went into her medical system. And, I didn't even think about it back then. I actually didn't realize the connection until maybe 3 or 6 months later when Ann and I were teaching again. And Ann said something in class when I was like, oh, that's what happened. She went into her medical system and they were running urinalysis on her and they were giving her antibiotics, but nothing was coming up positive. Because what happened while mobilizing the interference field and mobilizing the scar, all the bugs that were kind of hiding in there long term were now, moving, and she was processing that, but it wasn't an acute infection. It was just the nervous system was cleaning up all of the mess that hasn't been cleaned up yet. And so what I do with that in my practice is I'm now really good at educating patients that this might happen. And I have them set up with herbs because I'm not worried about giving them herbal interventions. I'm a little bit more worried about giving them antibiotic interventions because that has more side effects. So I'll give them herbs or energetic remedies and I'll just kind of talk them through it. And I'll run a UA, but I know what's coming.
Yeah. And this is, just to just to kind of clarify, this is, I think, really the big difference between in infectious disease, there's acute infections and there's chronic infections. And I'm almost like ready to like leave the word infection behind because really what it is it's the microbiome. And if we have an overgrowth in our system somewhere of something that is more inflammatory or is not helpful to us, that can be a chronic infection. And we now know that the microbiome is not just in the gut, it's everywhere in our body. I mean, I remember them saying that there's bugs in the small intestine or there's, bacteria in the small intestine, but there's nothing that's in the little tubes that go up to the gallbladder and the liver. And I was like, well, that doesn't make any sense. I mean, it's all a mucosal tissue. So why wouldn't they be hanging out there? I mean, I want to go to every restaurant in Portland. I'm not just going to go to one restaurant in Portland. So I think this is important to think about is when we're doing neural therapy, we can treat some acute infections with it. But what we're really looking at for a lot of patients is these chronic hidden infections that cause pain, that cause inflammation, and that can cause, problems in the system. So, um, so let me give another example of that. Another example is I did have a patient this is one of my first patients that kind of helped me figure this out. She was actually another provider in town and she had knee surgery. She had like knee replacement surgery because I think she had broken her knee on, I don't know, skiing or something like that. And she never felt better after the knee surgery. She had been in PT for an entire year, trying to get better. And she still could hardly walk on the knee. She was still using like a walker or a cane. And she was only like 54 years old. She's not that old at all, and she had said to me, I feel like there's something still in there that's just not right, And so, and even I think that they put the wrong size of plate because they put a tibial plate in there. And when you looked at her knee, the tibial plate was super inflamed and it looked too big for her body. I was like, maybe they grabbed the wrong size. So she ended up, unfortunately, she had to pay for that surgery. So she went in to, go get another surgery to have them remove that plate. And then she came back in. She was still in a ton of pain. And her scar tissues, she had a big scar on the lateral portion of the knee and a big scar on the interior portion of the knee. And both of those scars were super duper painful. So I said, she would come to me for neural therapy. So she's like, let's do the scars. I think they need to be done after the second surgery. And so we did the scars. And after like maybe about 12 hours later, she sent me a photo. And the photo was of this like long scar. I wish I had taken a picture of it. I did. I didn't have it. I don't have it anymore. I think she sent it to me, but I didn't keep it. So it was like this elongated, Frankenstein type scar with like a red circle that was starting to form and come up and out from around the scar. And I was like, oh, that looks like cellulitis, So we ended up I put her on Keflex, which is a very common antibiotic that we use for for cellulitis, and it totally cleared up, and actually her pain went away. And what we ended up realizing, is she had an infection in the knee from the very onset of them doing that knee surgery, like a few months prior, because she had the knee surgery about a year after. So most of the time, it's that there's a microbiome imbalance, and we're helping the nervous system with neural therapy to be able to talk to the immune system and have the immune system work better to kind of resolve that microbiome imbalance, right? But sometimes, and this has not happened often, I've been doing neural therapy for over 10 years for sure at this point. Sometimes we will actually open up a a can of worms, and there will actually be an infection. So there has been I think probably about 4 or 5 times that I have needed to give antibiotics. But mostly it has just been resolved with herbs. And it's, again, like as Ilana was saying, a lot of times it can be similar feelings that the patients have had, like when they've had chronic urinary tract infections or chronic, shoulder pain or something like that. And then it resolves.
So the other thing that is super important to know is this pattern happens virtually all the time with port. So with
Yeah.
port scars, you do, because there's so much that goes into there, and, there's a lot of emotional stuff that is attached to a port scar. That is where you can usually have issues. I'm very, very reticent when I inject port scars, and I'm really aggressive about educating the patient. I've had enough bad experiences where that's a big one.
Well, port scars are like an open wound, really. And they have actually done studies on port scars. So they do know that port scars do hold on to bacteria that just stays in the tissue. When you're doing the port scar, it's going to kind of open that up and help push things out of the body. So, yeah. Um, the other thing I'd love to talk about is the vaccine. The vaccine, any vaccine really can do this. Okay, so we had one patient who came in. Well, she had had a vaccine. She's a medical student, and she had had a vaccine.
Now she's a
And
provider.
pardon?
Now she's a provider. She wasn't.
Now she's a doctor. Yes. So she had had a vaccine when she was in school, because everybody was getting vaccinated in school, and she didn't have any musculoskeletal issues before this vaccine. But now, as soon as she got the vaccine, all of the musculoskeletal aches and pains from any areas in her body that she had problems before started showing up. So she had had sort of chronic low back pain earlier in her life. She had had ankle pain earlier in her life, or she would roll her ankle and stuff. So this was a year after we saw her, or a year after the vaccine. She was still having chronic musculoskeletal pains. Now, where's the interference field there? That's what you always have to ask. You always have to kind of go back to what's the beginning of where did this story start? And the story started, well, obviously for the musculoskeletal stuff, that started, a long time before. But what was the straw that broke the camel's back? The straw that broke the camel's back was the vaccine. And again, I want to say we're not anti vaccine at all, but we just know that vaccines help the body to learn about infections. So that's what we're doing is we're introducing more infection into the body to
And
help the immune system learn, right?
they ask a lot of the immune system. Like, we're asking the immune system to give a big response so the patient does not get sick. Like, that's the whole point of a vaccination, even
Yeah,
when you're using a denatured virus.
right. hmm So what for her really what the issue was at that point is okay, the vaccine was her interference field. And we do this a lot where we'll just do like a surround the dragon technique around the deltoid muscle where they got the vaccine. If my patients don't remember which deltoid they got it in, I'll just do the procaine and ozone as well in both deltoid muscles, just kind of surrounding like where you would typically put a vaccine. So as soon as she got that treatment with the procaine, her musculoskeletal pain completely went away. So that's, I think, is a great example of an interference field and one that, a lot of them are kind of obvious. It's like, oh, okay, well, there's a scar here. This is where you have your pain. But this is like one that you're like, if she hadn't told me, like, oh, it started right after I got this vaccine in medical school, it might have been taken us a little while to figure it out. So,
And that is where the history of the lifetime is very important. It's where you can never replace the history part of your exam because that is going to guide you to where you need to act next.
exactly.
I wish there was an easy place to be like, oh, there's a blood test that tells me where the interference field is. There isn't. It really comes back down to listening to the patient, watching their reactions, feeling the body, looking at where the body is. Maybe carrying a lot more heat or carrying less heat or more red or more pale, and that's really how you make your choices.
Yeah. Yeah. Yeah.
Anything else that we wanna talk about with interference fields?
I mean, we could probably go on and on all day about interference
That's
fields.
true. We do have 1,000 stories.
um, so yeah, I think as again, as Ilana had said, as we're interviewing all these amazing neural therapists, we're realizing there's probably a lot of you that don't know what an interference field is and are like, well, maybe we should talk about some of these really basic concepts of neural therapy. So we wanted to make sure to include that in our podcast. So I'm hoping that this is helpful for all of you and um, that, when you're looking at, if you're a patient or a provider, and if you're thinking about, oh, there's always this one part of my body that I just don't feel like a lot of times people will tell me, I don't really feel connected to this part of my body. Or I feel like I mean, I've heard this time and time again. I always get injured on my right side, or I always get injured on my left side, or why do I have so many injuries to my left knee? I don't understand. And a lot of that is because it's an interference field. And what might be good is to consider doing some neural therapy on it because it's pretty easy and quick and it doesn't involve surgery.
'Cause that's always where I first start before I do something more interventive, is
Yeah,
why not try?
exactly. Yeah. Great.
Okay.
Well, thanks for joining us today. And I'm sure that we're going to have some more fun conversations. We'll do some more conversations maybe on interference fields, mental emotional stuff, other things that come
Propane.
up, procaine, lots of fun things. Yeah.
Thanks, everybody. Bye-bye.
Bye.